Michael Isaacson, Assistant Director of the Community Health at the Kane County Health Department, and we're going to be discussing COVID, status of COVID-19, and we want your comments. So come on in, folks. Let's bring up Michael. Hi, Michael.
Hey, John. How are you today?
All righty. That's my picnic table in the back there with my big Sox cap on and a drink of a little coffee there and enjoying the White Sox right now. But we hope everything returns more normal in the next year here, and this COVID-19 is still out there. It's a bad kid, but maybe it's, I don't know. We'll discuss more of this. I just want to welcome Brother Michael. I think it was about September 1st we had you on last, or it's about then. So it's been almost a month here since we last talked, and there's a lot of things happening here. So, Michael, how you been? And give us a little update. And we welcome Michael Isaacson. And Michael, give us a little update, what you think about COVID and Kane County, and just whatever you want to touch base to start out here.
Okay, sounds good, John. Thank you for having me back on the show. I think we are finally, I hope, starting to see a little downturn in cases in terms of this most recent peak that we have been experiencing here in our community. So our peak was quite a bit lower than a lot of places around the country that don't have as good a vaccination rates as we have here in the Chicagoland area. And also, I think, unlike a lot of places in the country with the masks, even though there's pockets and we get a fair number of complaints from people about going out and not seeing people wear the masks, we still have a lot of people who are wearing face coverings. And there continues to be additional research coming out showing how that really is helpful. We just had a conversation with the state health department this morning, and they shared a couple documents that showed in schools, specifically in schools where they were asking the children to wear face coverings, compared to where they weren't asking them to wear face coverings. The places that didn't have face covering requirements had 3.5 times as many outbreaks as what we're seeing here in Illinois. So this is something definitely the face coverings are helping. We are about to hit a milestone. It should be probably tomorrow, or actually today. We probably have administered our 600,000th shot to a Kane County resident. So those are some real numbers there. So 600,000 shots to Kane County residents. Wow. Really happy with how people have been stepping forward to get vaccinated. We know there's a lot of questions still that people have, but it seems like more and more people are getting comfortable. Everybody responds to the different mandates that are being implemented. People have strong emotional responses to that, which we certainly respect that people have their own feelings about that. I'll take a step away from the mandates. Kane County Health Department's not putting any of these mandates in place. But I can say, unequivocally, people who are vaccinated are much safer in this current environment, and it makes it a safer environment for all of us. So I just continue to encourage people to, ask their medical provider if they have any questions, and hopefully step forward and get the vaccine for themselves.
That's very good. I think I was talking to my cousin out in California last night, and I was mentioning about masks, and if I'm not mistaken, last year, or I guess it'd be the 2020 winter, or whatever you want to call it, that there was very low flu and very low colds. Is that correct? I mean,
that is
very
correct.
Low.
Absolutely. Yeah, our flu season last year was almost non-existent. So it is something we're keeping an eye on, and people can get the flu shot at the same time as the COVID vaccine. And so we're strongly encouraging people to make sure they're prepared for both viruses.
Yeah, well, my thought was on the masking thought and the social distancing. That proves that masks and social distancing, colds, flu, I mean, it's It's just masks do work.
They work.
They do work. So I guess the surgeons too want to wear a mask. I think you'd want your surgeon to wear a mask too, I think.
Definitely. I talk to people all the time. It seems like more and more who are talking about people getting colds and just how strange that is since so many people reported not coming down with stuff last year.
Yeah, last year it was like, and the flu was almost like you said. I think when I saw the number, it was just really, really low. I mean, like you said, non-existent. I mean, we've had thousands die, maybe only less than 1,000. I forgot the number. It was really low though.
Yes.
Yeah. So,
and and unfortunately, I'm pretty optimistic again about where we are with COVID and the progress that we continue to make. But here in the last 3 weeks, we've lost someone in Kane County, on average, almost a person a day.
right.
So even though I think things are going to get better soon,
Right.
in terms of people losing their lives, and especially with people who are unvaccinated, and not to diminish the loss of life or the pain that families are experiencing. So, but we can avoid this.
Yes.
So just get people out and hopefully they make a choice for themselves to get vaccinated.
We need to get that vaccinated out there. And I have a friend. I think she had her double dose yesterday. I think that was the schedule. But we got to get people vaccinated around, and our young ones too. That's a very important thing with school. And
I can't say, John, there we heard some good news from the state today that they anticipate that the vaccine will be approved for the younger ones by Halloween. So that's going to help tremendously. That'll probably be 5 and up, and then
right.
shortly after that, we'll probably see 2 and up. And then for the younger ones, they spend more time studying that, so that'll probably take a little longer to get approved. But that's going to be a tremendous help in terms of stopping the spread of this virus in our community.
I think so. And I just got a note from my pharmacy that I took my 2 shots from. 2 out of those 600,000 shots that you mentioned. And I think I didn't get pulled all up, but it's probably telling me about coming back for that booster, I would think. What can you say about our vaccine boosters in King County?
Yeah, let me split this into 2 separate things. So first, what we heard about was a 3rd shot for people who may have an issue that is impacting their immune system. So that 3rd shot, which is technically different than a booster, is available for somebody who maybe have
Well, it's
recently
not quite the right term. Maybe boosters. Not.
Well, there is a booster. You're correct about that, but there's 2 separate things. So
Oh, really?
Yeah. So the 3rd shot's available to people, and that's whether they had Moderna or Pfizer, and if they have had an organ transplant, if they're taking high doses of steroids or any medication that may impact their immune system. They're suggested to come in and get a 3rd shot that really will hopefully bring their immune system up to where they would be, fully vaccinated.
Right.
So that's going on now. People, we encourage them to talk to their physician if they have any questions. I mean, certainly if they have one of those conditions, they're probably under the care of a physician. Ask their questions, and they can come to our clinics or any of the other clinics in the community and get that 3rd shot. Now, separate from that is the booster shots. So that's for people who maybe have a normally functioning immune system. That the guidance just came out just last week. Even though there's been talk about it in the media for over a month now, the committee made their recommendations, and the director at the CDC made some recommendations based on that information. So now what we're looking at is for anyone over 65 or people who live in a long-term care facility, that they're encouraged to come and get a booster shot. So it is a 3rd shot, but in this case, it would technically be a booster shot. And then also they're opening it up and saying people who are younger and may have a health condition,
Right.
or people who may be in a job that puts them at increased risk, they
Right.
also may be able to come forward and get a third shot now. So that's where it broadened out a little bit beyond what the advisory group who makes the recommendations.
Right.
The CDC wanted to get more vaccine to more people. So again, we're offering those third shots and those booster shots. Now with the booster shot, I want to point out that right now is only for people who had Pfizer. They're looking at Moderna, and we expect that guidance will be coming out soon. So
Right.
it is a little confusing. So the third shot for people who have an immune issue,
Yeah.
that's for Moderna or Pfizer. Currently, the booster shot for people 65 and over living in long-term care centers, or that broader group that the CDC
Right.
has recommended, that's currently only Pfizer.
And that's after 6 months, right?
That one's after 6
Well,
months. Yeah,
that's a lot of the older people because they got the shots earlier. So I mean, it's probably right now, but it might not be. But it's 6 months, and probably within the next month or so for
around here.
everybody
Yeah,
in that category.
exactly.
But it's
Exactly.
6 months, and I had my shots and finished up in late March.
Okay.
So I think
Oh
mine's
yeah,
mine's 6 months is coming up right now about.
yeah.
So
And did you have Pfizer? I can't remember.
I had Pfizer.
Okay, sure.
And I
So
had it
yeah,
over at Meyer. I think I was just mentioning that. I got a note from them. I assume that's what I got the note on. But they were pretty good at watching it. So I think that might be what it's from the pharmacy. And that's not my regular pharmacy, but they were pretty good on the whole thing. I was pleased with that. And that early time, I know a lot of people were fighting to get where to get the vaccinations.
sure. And you raise a good point with by pointing out that for that booster shot, we want it to be 6 months later. For the third dose, for people who may have a compromised immune system, that only needs to be 28 days after.
Oh, really?
Shot. Right, because it's still.
I didn't catch that difference before,
Yeah.
Michael.
Yep.
Oh, so
So
the immune system, they want to get it in right away, even sooner.
yep. Because
Okay,
it's really.
I didn't catch that before.
Yeah.
Yeah, and well, I hope somebody was out there. We'll just have to hope someone's. Well, maybe they're listening. Good. I hope they're listening. We're informing them so much they don't have any questions, or comments. But I would love that if you're out there, if you can give us a comment. Now, do we have more than one site, or you got that one on Randall there? Is there another one? I forgot now. I know you have this one, but that's correct, right?
Yeah, so we have the one site on Randall, which we're operating on Wednesday afternoons, and also on Saturday mornings. So Saturday morning is 9 to noon, or noon to 4 on Wednesdays. But then also we were kind of waiting for this booster guidance, so that we could make a determination just to see how many people may be coming forward to get their booster shots from us. And then we're certainly prepared to go and work in other communities around Kane County to make sure vaccine is available. And then, of course, we continue to partner with great organizations like the VNA and our hospitals here in Kane County, Greater Family Health up in Elgin, so as well as all the pharmacies. So there's, unlike back in February, there's plenty of vaccine and lots of places where people can get it.
It's a lot better it was then, and the follow-up to the whole. Of course, we just took a while to everything to get in order, but finally it's a little more order here, and I think we figured out a little more how to do these things. Like Michael said, I have the VNA at the bottom. They do the vaccinations, and then, of course, the county website is kanevax.org, and that's a beautiful site. So remember, you can learn more about what Michael's talking about and other things at kanevax.org. And Michael, I know this is a newer topic, this one, and about this monoclonal antibodies.
Sure.
The lady in the paper, Cosby, said this was a tough one to pronounce. And I go, well, maybe it is. I know I butchered that, but some doctors are offering that. That's after generally you come down with it, but early stage, right? I think that's how it works.
Exactly. Yeah, this is something that's provided by the actual medical providers. We do have in our local hospitals, they do have access to provide it, and it has shown to be pretty effective at helping reduce the severity of illness for people. But I'm not a clinician, so I probably can't say too much about it. But it is nice as time's gone on that we've identified additional treatments that can help people.
I think that's maybe the kind of thing President Trump took, maybe, or something like that.
Yeah, I think that sounds familiar. Yes.
When he had his COVID, and but I think it's been helpful, but it's somewhat expensive and it's late. So you're going to get some. It's not a total answer, but it's a good therapy here that we have, so you can get out of it faster, and that's always good. And
Right. Well,
but
I think a good parallel here is like I'm glad that my car has an airbag, but it's much better to not get in an accident, right? So
that's correct.
if we can get a vaccine and avoid getting sick in the first place, we're much better off.
Right. That is very true. And so we want to spread the word about getting the vaccine and getting that shots. And that's why we're pulling this together here a little today and just telling everybody, get those shots. It's still out there. Some say this is going to peak maybe by, well, I don't know, but the Delta going to peak maybe by Thanksgiving. I've heard different theories on this. I'm not what we call the virologist or whatever you want to call it. I'm not, but I've heard these different theories on that. What do you heard on that, Michael?
Yeah, it kind of runs the gamut. There's a lot of different models out there that are, some are more hopeful than others. And a couple of things we need to be concerned about. One, different variants. So Delta has really caused a lot of damage in our communities. But we need to be aware that as long as people are continuing to get sick, that creates an opportunity for more variants to emerge. A second thing that we need to be aware of is as the weather gets cool, which is nice and refreshing on one hand, we also start to get inside a little bit more. So we have a little bit of time here where the weather's going to be pleasant. But then it'll be entering the holiday season where we're more likely to be mixing people from different households, coming together, and that creates more of an opportunity for a virus to be transmitted from person to person. So, of course, our big spike last year started right after Halloween. So we're wary of what may be coming. But again, we're in a much better position than we were a year ago. With well over 70% of our residents have had at least one shot. Those that are eligible for 12 years old and over. So we're in a much better position, but still just some of the face covering guidance and trying to limit how much exposure we have to other people is still going to be helpful.
I know that's very important to do that. And another thing that's happening out there in the school settings and other community center settings is when somebody gets COVID. This was in today's paper. Maybe you saw that in the Beacon News, or Beacon News, about contact tracers that your group, the Kane County Health Department, probably you had them before, but sort of downsized, and now you got to get back because school's back, I guess, and there's a little more chance of some virus out there, and we got to watch that. What's the story on the contact tracers in the county?
Yeah, no, that's a great issue to talk about. First, I just want to say I not only do we have a fantastic team here at the health department who's working on doing case investigations, and also contact tracing. We have a lot of people on contract with us who are doing contact tracing, making those phone calls. But also, I just want to really applaud all of the work that our schools are putting in to keep people safe. And I don't think people understand how big a job this is. If you think about somebody who is in a school setting and tests positive, and then the schools are helping to identify people who may have been in contact with that student. The health department is following up and conducting interviews, making sure that people who may potentially be able to transmit the virus are staying away from others. This is a huge task, and the schools have done an absolutely fantastic job with it. But as you mentioned, when the number of cases goes up, like it has over the past couple of months, the number of cases that need to be explored goes up. And so we're trying to be good stewards of our resources, and we have reduced the number of people that we have who are making those phone calls to try not to have people sitting there not answering the phone. But when we started to get this big spike, it became near impossible for us to keep up with the number of calls that we need to make. And when we get a backlog of calls, not only does that interfere with our ability to contain the virus, but it also makes a frustrating situation for families even more frustrating because people may be waiting for clearance to get back to work or to get back to school. And in many cases, that can't be done until these interviews are completed. So additional resources to help with the contact tracing is something that we definitely have needed here in the county, and we're moving to expand now so that we can get to these calls in a timely manner.
That's a very good thing to get on top of it, and then so we can watch where it's coming from and nip it in the bud, as they say. And it's very important. What was I going to say here? Well, what are some of the other things that you can think of? We talked about the flu shot and other things. What do you think other future things for Kane County on health front, would you say, Michael?
Yeah, I think one thing that's a big one for me is certainly behavioral health. As we look at mental health issues and substance use issues, these are areas that have been exacerbated during COVID. So that's somewhere where we want to really shift resources and put a large focus on how we can best support our residents because a lot of people need help. Also, just we happen to be in a process right now where we're rolling out what we call our community health improvement plan. And this is something that we do in partnership with our hospitals and the Inc. board, the mental health board here in Aurora, where we do focus groups, we do telephone surveys, we do online surveys. We look at all the data to see why are people dying in Kane County, why are people getting sick, in addition to COVID. And we then take that information to the community, and they can vote on what the priorities should be. So our priorities going into this next 3-year cycle are going to be, number one, one that I'm working most closely with is behavioral health. We're also looking at nutrition, exercise, and weight, healthy weights as a big area that we want to focus on. Some people use the time during COVID to get in shape. But for many other people with stress and being stuck at home,
it's the opposite, right?
Yep, you got it. Lots of snacks and things people had.
Oh, come on, Michael.
Yeah.
Snacks. Oh, go on.
No, I know it's tough. We're also looking at other infectious diseases, as well as a fourth group, which is access to healthcare. So those are our 4 formal issues that have been identified as part of this community-wide health assessment process.
Yeah, earlier I'll just regress a minute. You talked about where we're at with COVID. We are stabilized and going down. That's verified by numbers. And one site that I recommend to look at the national, and Kane, you can look at Kane even through that one. The New York Times has a nice site on this kind of stuff. It's updated each day, and I've been looking at that. And then the positivity rate is down too, right? That's right, isn't it?
Yeah. So, and the positivity rate, we want that to be low, and in Kane County right now, it's down around 3.2%. I can tell you in other places around the country, when I just kind of spot check, there's still places where the positivity rate is up over 20%. But it is important to point out that we're very aggressive with our testing here in Illinois, and people are doing a great job getting tested when they think they may have been exposed. So, anytime we're working with a percentage, the more testing we do, that increases the denominator and is automatically going to drive down that positivity rate. So it is a great positivity rate, but if we were in another community somewhere in America where people weren't going to get tested unless they were sick, then they're going to have a higher positivity rate. But it doesn't necessarily fully reflect what's happening out in the community.
And we've had, I don't know what our case per 100,000 is. It was, well, somewhere around 20, wasn't it? A little lower or about, I forgot what it is right now.
Yeah, so I've been referencing the CDC, their CDC COVID tracker, and
Right,
they look at the rate per 100,000 residents per week,
right.
and we're right around 130 cases. We've been kind of
Oh,
bouncing
the total
around.
amount of cases, but
Yeah,
that's not per 100,000. That would
that's
be,
per 100,000. That's per week though. So
no,
it's
I mean,
probably,
that's how much the whole county gets. That's
yes.
not per 100,000, because otherwise that'd be pretty high.
No,
I'm
it's
pretty
per
sure
100,000.
that's not per 100,000. That's just the
Yeah.
total amount of cases in
No,
King
that's per
County.
100,000 per week. So take your number and multiply it by 7. So that's,
Okay, per day, then it's
yes.
okay. Okay,
Yeah.
okay. I hear how you're doing that.
And
Okay.
that just kind of, we do the
So
week
it's
just
about
because it
20 or
averages out.
less, which is low. I mean, there's some other areas that are really less, like Idaho and
Yeah,
Alaska.
and I'm from Idaho, John, and I don't know if people watch me give presentations, that's something I frequently will compare, and their rate there is 5 or 600 per 100,000, and you can't get a hospital bed.
Right.
So you better hope you don't get in a car wreck because it's bad.
Right. They changed their status on hospital. I forget what they call it. It's a new stat. It's a different
Yeah,
status in the hospitals, and the same in Alaska and a few other areas too. So uh, this variant has been wicked in other parts of the country.
it has definitely. But and also I know, and I love it out there, and I have friends and family there, but it's also a place where vaccine rates are quite a bit lower,
Oh
and
yes. Oh
people are not
oh.
wearing masks.
Idaho's really like
Yeah,
35%
yeah.
or fully. I mean, it's pretty low. Yeah. Some of these are just downright. Well, they're not great. No, they're
No, and I certainly respect, and even people locally, there's a lot of conversation about freedom, whether it comes to masks, vaccine, etc. Again, as a local health department, I'll take a step back from that, but the fact remains, if people choose not to wear a face covering, if they choose not to social distance, if they choose not to get vaccinated, uh, there can be serious consequences from that. That's not avoidable, and that's
I'll be tougher.
separate from the
Some would
debate.
say they might be choosing the COVID and choosing death. That's known, I guess, a known fact. Those who are not vaccinated and they're not in great shape for COVID. So I'll be a little
Yeah,
tougher on that one,
the
Michael.
vaccine is definitely the best tool we have.
No, you got to get that vaccine out there. We want, and I have a relative in Idaho. They were in California in the foothills, and I think they like that idea and go to Idaho and that wooded area stuff. But then they have fires too. I actually, Illinois, we're pretty good. We don't have fires, we don't have earthquakes, but maybe we have. We might get a tornado, but we're pretty good that way. And we're very fortunate that we have a good control right now on the virus here, and we got to get better. And Michael and the Kane County Health Department are working on that. And I really appreciate Michael taking a little time with us this afternoon. And you mentioned something that I haven't really thought about as much. I know I had a friend in Kiwanis who was really big on the suicide side of mental health out in Yorkville. What's his first name? Frieders is the last name. I can't think of his. It'll come to me. But anyway, it was Quanian, and he was doing a lot on that front. because he lost a friend. And
yeah, and we it's actually September has been Suicide Awareness Month.
oh, okay.
So we have been engaged in a lot of activities in the different communities, and have done some art projects specifically focused on youth that we were able to participate in downtown Aurora and in some of the other communities. So trying to raise awareness so that people know, and to get people talking, and to get people to understand that if they're struggling, they can go and talk to somebody, and we're not alone, we're in this together. So we really want people to find the help that they need.
Right, that's very important. So, and then on Wednesday we're going to have another brother who's Sonny DiRama of VNA. We're going to touch base on some of the same topics here, but we're going to expand to what they're doing. And we love these groups, and we love what Michael and the health department's doing. And so I just want to thank Michael for coming by and visiting with us. And if you need a shot or other things, we've got the VNA down at the bottom of the screen, and we got the Kane Vax. You can get right there and get a lot of information at kanevax.org. So again, thank you, Michael, for coming by and visiting with me today.
My pleasure.
And we'll just say till next time now, God bless, and bye-bye, everybody. Bye-bye now.